Do you really believe big pharmaceutical companies have your best interest in mind? Have you ever read the warning labels on the side of your medicine bottle or the fine print pamphlet that comes along with it? Many actually state that sudden death may occur. Now we'll hear from Dr. Bonati about how ObamaCare, this administration, and the FDA continue putting big pharma profits ahead of patients. Dr. Bonati, we already know how you feel about ObamaCare, but what do you think about the FDA kind of being in bed with ObamaCare and Big Pharma?
Well, Obama messed up everything in this country. Everything that was working before is practically confused, destroyed, or they are creating business that they are not in benefit of the country. For example, the big ObamaCare allowed pharmacists, the big pharmaceutical companies, to regulate themselves and skip the procedures that they are required by the FDA to be able to approve one of the medications. That is going to create for the big pharma business around $475 billion for the next 2020. So in 4 years from now, they are going to make that amount of money due to the regulations that they are going to skip. When they skip the clinical trials, you have a real problem, because then you don't know if that medication is good or not.
Well, the citizens or the patients would then become the guinea pig, correct?
Why we need to have an FDA if they're going to skip the clinical trials? It's another confusion that this individual brought to this beautiful country. This man should resign to this position. He's so incompetent. I don't understand yet why he's not being impeached.
You've mentioned how ObamaCare is going to turn the healthcare industry into that of medical prescriptions versus true healthcare. And we're seeing an influx of people dying from opioids. The number of deaths have quadrupled since 1999. And then we're also hearing that the FDA is approving more potent opioids, more so than heroin. What are your thoughts on that?
The socialistic and communistic societies, they destroyed in medicine, they destroyed the specialist. They make the specialist obsolete because they don't really want that the people will survive and last forever. If you have a socialistic society, the leaders of a socialistic government, they want the people be placed in pills. So they joined the big pharmacy companies because the pharmaceuticals will kill people. So they will control pain by opiates, and is right now in the country 2.1 million people that they are suffering with substance abuse. And also these pain relievers are something that you use, and 4 hours after you need to use it again.
Correct.
So the amount of revenue that they give to the pharmaceutical companies and then to the government is enormous.
Sure.
So the idea is make the people practically suffer with pain, or otherwise make the people not being treated. Because really, this country has the best medicine in the world, not because we are using pharmaceutical products or because we are using general practitioners. Is because the technology of the American medicine based on specialties are creating an individual who has a tremendous amount of knowledge in that specific specialty.
Sure.
so we can remove the pain.
What do you think happens to these patients? Obviously, there's drug addiction, but when these patients go back and see their doctor and say, I'm still in pain, I've already been taking this, what do they try next?
Well, what happens is the drug companies are very smart. They give to you a certain amount of drugs, and then suddenly they develop another drug that is more potent than the one before. And then the people start to consume this type of a product. And large amount of these people die. More females die than males with these drugs. In 1991, I think there were 74 million prescriptions were issued in a year. Today is 240 million prescriptions for hydrocodone only prescribed in a year. That is also because, unfortunately, medicine is changing from the specialties that we always had in this country that make medicine the best of the world, to a managed medicine by internal medical or by family physicians, that the only thing that they do is prescribe drugs.
Right.
Well, sometimes I have patients that they come to my clinic and they have a brown bag full of different medications. When I look at the medications, the A medication is producing symptoms with the B medication, and the B medication is attacking the C medication. And then when you go and you say, who is checking all these things? Well, nobody's checking, although there are certain type of restrictions on medication being done by the pharmacy now, because yes, the pharmaceutical products start to put doctors that they are not doctors, that they are pharmacist people prescribing in the pharmacy and doing medical and clinical evaluations in the pharmacy. And American Medical Association is sleeping on the switches. And this is what is really amazing. They tell you, you need this medication, and they formulate the medication for you. And then they go and they read the complications that you're gonna have. And when the complications that you're gonna have is a horrendous complications, one after the other one. But you know what is? That is another tactic of the socialistic society. They tell you those things so you don't listen anymore. It's like, oh yeah, well, forget it. They always say these things. So you forget, really.
Or they desensitize.
Yeah, they desensitize. And that is the management of every socialistic society.
Thank you for watching American Medicine Today. Remember, you do not have to live with spine pain. There is an option. Stop suffering and seek a consultation to see if the world-renowned Bonati spine procedures can help you. If you have a recent MRI, make sure you send it in for a free review. If you have any comments or questions, contact us at the number below. You may be featured on a future show. Tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.